Miss Wells is a pleasant 28-year-old African-American woman. The patient presented to the clinic with complaints of shortness of breath and wheezing following a near asthma attack that she had 2 days ago. She reports that she was at her cousin's house and was exposed to cats, which triggered her asthma symptoms. At the time of the asthma attack, she notes that her wheezes were a 6 out of 10 severity and her shortness of breath was an 8 out of 10 severity, and this lasted for 5 minutes. At the time, she used her albuterol inhaler and her symptoms decreased, although they did not completely resolve. She notes that her current symptoms seem to be worsened by lying flat and movement and are accompanied by a non-productive cough. Since that incident, she notes that she has had 10 episodes of wheezing and shortness of breath approximately every 4 hours. She awakens with nighttime shortness of breath twice per night. Her last episode of shortness of breath was this morning before coming to the clinic. She complains that her current symptoms are beginning to interfere with her daily activities, and she is concerned that her albuterol inhaler seems to be less effective than previous. Currently, she states her breathing is normal. This patient was diagnosed with asthma at age 2.5 years. She has no recent use of spirometry, does not use a peak flow, does not record attacks, and does not have a home nebulizer or vaporizer. She has been hospitalized 5 times for asthma. The last one was at age 16. She has never been intubated for asthma. She does not have a current pulmonologist or allergist. She is not aware of any environmental exposures or irritants at her job or home. She denies current use of tobacco, alcohol, and illicit drugs. She did smoke marijuana for 5 or 6 years. Her last use was at age 21 years, and she does not exercise. Currently, she is alert and oriented and sitting upright on the exam table. She maintains eye contact throughout the interview and examination and shows no acute distress. Chest expansion is symmetrical with respirations. There is normal fremitus, symmetric bilaterally. Chest resonant to percussion, no dullness noted. Bilateral expiratory wheezes in posterior lower lobes. Bilateral muffled words with notable expiratory wheezes in posterior lower lobes, and there are no crackles noted. In office, her spirometry was FVC 3.91 liters. FEV1 FVC ratio was 80.56%, and her SpO2 was 97%. According to the NAEPP guidelines, Miss Wells should have an inhaled corticosteroid added to her asthma regimen because her albuterol inhaler alone is not sufficient enough to treat her asthma symptoms.